Hi, Dr. Eric, the fitness physician here. In today's special video, I'm going to talk about why insulin sensitivity is crucial for anti-aging. And this is part one. So eat less, exercise more. You've probably heard these types of tips repeated, whenever you see an article on improving your health and losing weight, right? But what if these tips don't seem to be working that effectively? What else can you do? Well, there are other factors that control and govern the many physiological processes that occur in our body and can change how our bodies respond to different lifestyle changes. Hormones, for one, which happens to be one of my specialties. So in my medical practice here at Primax, of course, I deal with hormonal optimization every day. Hormones, as you know, are chemical messengers, and they signal our bodies to initiate or stop certain functions within the body. These little messengers are produced by our endocrine glands, and they travel all around the body, and they impact all of our tissues and all of our organ systems. They affect our heart rate, sexual health, overall metabolism, and even body fat levels, and so much more. And that's why it's so important to learn the impact of hormones on your health goals, all your health goals. So while hormones like adrenaline, testosterone, estrogen, progesterone, and thyroid are often discussed in daily conversations, and they are very important, one hormone that is often overlooked when thinking about our health and fitness is insulin, and it's very misunderstood. So let's see how this hormone works and how you can manage it to improve anti-aging and improve body composition and overall health. Most people associate insulin as a drug you have to take after a doctor diagnoses you with diabetes, right? But it's really much, much more than that. And it's been villainized quite a bit. Everybody thinks it's terrible. It has a lot of uses. The hormone is devoted to helping our body absorb the fuels that we consume from our food. It enables us to take that fuel from everything that we eat and transport it, and the blood sugar, etc., to be utilized to our cells for energy. Think of insulin as the transporter hormone. It helps get the energy from the foods we eat to their destination so we can build muscle and make tissue and make things work properly. So it's very important. And where does this hormone come from? Well, it comes from our pancreas. It secretes insulin each time we ingest food to offset the spike in blood sugar. Because of that critical function it performs, it's clear that our body needs not only produce enough insulin, but to use it properly. This response is known as insulin sensitivity. You want to go up and then go right back down again. What's so important about our body being sensitive to insulin is that insulin sensitivity is crucial to basically our ability to use glucose for energy to perform those bodily functions and store glucose as glycogen in our muscles and our liver for future use. So you can see it's very important to understand how important it is to be sensitive to insulin. Our body composition absolutely plays a role in how sensitive we are to insulin, specifically regarding our muscle mass. And if we lose that sensitivity, we can gain fat. Think of it like this. Muscle tissue is expensive in terms of energy need and requires more blood sugar to sustain it. Hence, muscle is a major consumer of all of our available blood sugar. So the more muscle tissue we have, the more blood glucose that can be utilized for energy or transferred or stored in our muscles like glycogen for later use. When we have a lower percentage of muscle mass, our body has limited ability to remove this excess blood sugar to be used as energy or stored. So what happens when our body has insulin dysfunction or insulin resistance? Well, it's easy to see how these concepts surround the factors affecting your sensitivity to insulin, but it's also important to understand the negative effects of suboptimal insulin functionality or insulin resistance. While muscle tissue is important for fostering insulin sensitivity, having excessive body fat and being overweight, obese, can increase the risk of being diagnosed with disease such as diabetes, metabolic syndrome, and much, much more. So think of obesity and carrying around too much body fat and not enough muscle. These are the elements that increase insulin resistance and prevent glucose from being shuttled into your muscles and organs for use. Fortunately, type 2 diabetes, metabolic syndrome, and these other health conditions can be prevented with a healthy diet and proper exercise. So you want to take control of your insulin function with your nutrition and your fitness. Now that you understand the importance of insulin to our health and our wellness, the next step is to understand how nutrition can impact your overall insulin function. Not surprisingly, the foods we eat have a huge impact on our insulin levels and our insulin sensitivity. This is due to many factors, one of which is the glycemic index of certain foods, which is essentially a measure of a food's impact on post-meal blood sugar levels. While two foods can have an equal amount of overall macronutrients, they can have a wide range of impact on your blood sugar levels when you eat them, depending on this. So it comes down to insulin response. Not all carbs, for example, are created equal, nor any foods for that matter. While there's been much attention given to carbohydrate intake and low-carb diets in recent years, there's a fundamental concept to consider when you consider carbs and what they are, right? Again, they've also been vilified quite a bit. The glycemic index and the glycemic load of your carbohydrates matters tremendously. Understanding this is especially useful for all types of carbohydrates, as the type of carbohydrates you eat can have a wide range of impact on blood glucose and insulin response over time. Like I said, there's good carbs and bad carbs. So carbs with a higher glycemic index will be broken down to blood sugar much more quickly. And if they have a higher glycemic load, it tells you more about the total amount of carbohydrate in the food. And they're both important. Think of the glycemic index as a way of telling how quickly our body can break down the carbs into fuel, while the overall glycemic load will tell you how much carbohydrates you're getting from that food. In general, foods high in both glycemic index and glycemic load are to be consumed on more of a limited basis, especially if you're looking to lose weight and if you're looking to maximize your insulin response. So these are the foods to think of as like sugary sodas, candy, donuts, baked goods, cookies, all the stuff we like, right? You want to control how much of these foods you eat, cut back on those, right? You want more of a lower response. So carbohydrates high in fiber, such as like certain types of oats, beans, apples, fruit, vegetables, they will maximize your body's response to insulin, and they'll minimize those big spikes in blood sugar after eating them. These items can be part of a balanced diet, and over time, minimizing these large spikes in insulin is important when you're trying to maximize your body's sensitivity to insulin. This is going to improve that sensitivity, improve the optimal function that we talked about in part 1. Now, healthy fat can prevent insulin resistance as well. Same with protein. While we have explored and talked about carrying excessive body fat as being detrimental to our insulin sensitivity, how the types of fat that we eat impact our insulin sensitivity. Isn't fat bad? Well, unfortunately, fats have been kind of given a bad reputation, just like carbs, and in a somewhat misguided way, right? Healthy fats such as omega-3 polyunsaturated fats have been shown to help fight against insulin resistance. In more recent years, more studies have shown the importance of managing the ratio of the types of omega fats, right? The omega-3s we consume, these maximize our health benefits, and most of us eat too many omega-6s. We want to balance that out. While much of the diets in our modern society, like I said, in seeds and all the foods have way too many omega-6, the omega-6 to omega-3 ratio is way high, 15 to 1 or so. One more to be like 4 to 1 or 2 to 1. This has many positive impacts on our health. Practically, this just means replacing your vegetable oil with olive oil, right? And cutting back on, fried foods and things like that. So in addition to improving our role of insulin sensitivity, healthy fats are critical in helping maintain our cells and are also critical in the function and formation and use of our hormones. So a source of omega-3 polyunsaturated fats include wild salmon, flax seeds, walnuts, and eggs. And, all that fat has been, it's kind of, again, been painted in a poor light, but it's clear that healthy fats are critical for maximizing health. So get rid of all the vegetable oils, the seed oils, and replace them with omega-3s, healthy fats like coconut oil, eggs, avocado, etc. Now, protein is key to maximizing lean tissue. So as I mentioned, muscle mass is an important factor contributing to insulin sensitivity. So does that mean it's all about simply packing on muscle? Not necessarily, because it's important to understand the impact of the relative amount of lean tissues as compared to total body mass. Those with a higher ratio of lean muscle mass as compared to fat mass are shown to have better sensitivity to insulin and overall better health. There's ample evidence surrounding the impact of protein and their amino acid building blocks of them on helping us to build lean muscle tissue. So what's the takeaway? So use protein to help build lean muscle to support insulin sensitivity. So again, of course, sources of dietary protein include lean beef, cuts of beef, fish, eggs, poultry, game meats like buffalo, and of course plant sources like lentils, peas, and nuts, in addition to dairy sources like cottage cheese. Maximize your protein intakes to help you build muscle and burn that fat and optimize your metabolism. If you are looking for help with balancing your hormones, slowing the aging process, or losing weight in a medically proven and physician-directed way, or you are a fitness professional that wants a partner to help your clients with anti-aging protocols, or maybe you're a fitness professional looking to partner with a physician to help your clients optimize their health, just give us a call here at Primex Cellular Health, 740-777-9717, or shoot us an email at eric@drericfate.com. You can also visit us at drericprimex.com and check out all of our great age management solutions. We will get back to you right away and make sure you're set up for wellness success. And be sure to check out the Dr. Eric Primex YouTube, Instagram, and Facebook pages for informative videos and posts on all things hormones, muscle medicine, and weight loss and health. Thank you very much. Please like and share this video, and have a prime day.